So back in January, I was snowboarding. I decided to visit the terrain park. Though I was never great at snowboarding, I went off a jump that I usually land, and this time I really didn't. I stood up right away because I was embarrassed, so I tried to walk it off, if you will. And I realized it was in way more pain than usual, so I sort of pulled off to the side of the trail, assessed the situation, and after a few minutes, maybe 20, 30 minutes of pondering, I realized I really wasn't going to be able to make it down the mountain on my own. So I hiked back up to the closest lift, which thankfully wasn't too far, sat there for a few more minutes, and borderline agony, about to pass out. I told the lift attendant that I thought I had dislocated my shoulder, and I definitely couldn't get down on my own, so he brought me down in a sled. And thankfully, they had an orthopedic surgeon team that was at base camp, so Ski Patrol brought me in there to the clinic at the resort, and the orthopedic surgeon had x-rays taken, and then they were able to twist my arm back into its socket, and the pain went down immediately. It was instant relief. But then they sort of started talking to me about follow-up and how these accidents, they tend to be recurring, or this injury rather, and that it was high risk for it popping out again, basically. And I'm thinking I have a lot of anxiety about all the different activities that I'm gonna have to avoid doing or severely and significantly modify, and what's gonna happen if I'm out in the wilderness and it dislocates and I can't put it back in place myself. So I drove myself home using just my right arm, and I spent the rest of the weekend doing research, ways I could rehabilitate this as quickly as possible, whether I was going to be able to return to certain activities quickly or even at all. And a lot of the answers that I found online sort of pointed to the fact that your shoulder, since ligaments are torn and they don't regrow on their own, unless you get surgery for it, it's never going to be back to 100%. And just like the orthopedic surgeon said, that the risk of having this injury again is very high. So I kept the sling on for the next week, which is about how long it took to get a follow-up appointment with the orthopedic surgeon. And when I met with him, he was telling me that he would never rush into surgery for anybody, but in his experience, he's been practicing for 20 plus years. A lot of times the issues do recur, especially for people who are younger and have significant labrum damage. You're out cycling or running, it's not a big deal. But for me, I really wanted to get back into strength training and weightlifting, as well as things like rock climbing too, which require dynamic movements of the shoulder and put a lot of stress on it. At the appointment, the orthopedic surgeon said I could spend less time out of the sling, but I was diligent about following best practices to make sure that it was gonna heal up correctly the first time, because I don't know if I could live with the stress of being at the gym, having weight above my head and wondering if my arm's gonna pop out. But at this point, I'm feeling really anxious about the whole situation. I don't know what it looks like internally. Nobody does. I didn't have an MRI. And just sitting and waiting for 6 weeks or 12 weeks or however long it takes wasn't really something that I was too excited about. It was about the same time that I started corresponding with Dr. McNeil, and Ryan said he would be happy to help me out. You know, it was perfect timing. My follow-up with the orthopedic surgeon wasn't for several months. I didn't have too much to do in between then, except make sure I wasn't overworking the shoulder. But I couldn't do any of my normal exercises. I was worried I was totally gonna fall out of routine. I didn't know if I was gonna be able to get back on the mountain bike, be able to go snowboarding again for the rest of the season. And Ryan really gave me the time to sort of listen to my story and helped formulate a plan. We met virtually through the online portal that he has set up. He spent most of the time just listening to what I had to say and the concerns that I had, my goals, as well as the research that I'd done. It felt good to be able to have credibility with Ryan as well. He believed everything I said. I didn't have to, over and over reiterate whether I was in pain or tell him I was concerned about doing certain exercises, because he believed it right away. During our first consultation, we wanted to get a baseline to see where I was at, not just my left shoulder, but with my right shoulder as well. So then we moved on to discussing what some possible courses of treatment are and some possible outcomes. Ryan really set realistic expectations with me early on that I was going to have certain exercises such as bench press and pull-ups that were going to take a long time to get back to my normal strength and normal volume with. And although it was something I didn't want to hear, it was great to know that if we followed the regimen, it was going to heal properly the first time, and I wasn't going to be as high of risk for having a dislocation again, which was my entire purpose for putting energy into this in the first place. As you might imagine, I had a lot of questions along the way. I hadn't really spent any time thinking about how the shoulder works, and that was all changing. I really wanted to know from a theoretical point of view what was going on in there, even though we didn't have an MRI picture that showed us exactly where the torn labrum was. We knew that it was torn. That happens in almost every dislocation. And Ryan gave me a lot of background on that, explaining how the shoulder works, how the rotation works, what type of dislocation it was. which was confirmed by my orthopedic surgeon too. And so I really appreciated that level of insight. It wasn't dumbed down in a way that was not going to be useful, but it's something that I could take into account when I'm at the gym and I'm trying a new exercise. So most of the exercises that were assigned to me and that Ryan and I worked on during our sessions and that I kept up on using the PT app in between sessions in a checklist fashion, they were all stabilization, and it made a huge difference. I think the interesting thing about this whole situation is that my arm, or both arms really, I was doing it on both sides, are more stable and I feel like more secure because of those stabilization muscles than they were even before this injury. But assigning exercises that have been used for other people with similar injuries and just something that in theory should work wasn't good enough for Ryan. He wanted to make sure that we're measuring the progress at each and every one of our sessions with regular check-ins in between, through the messaging app. And my personal goal for myself to measure my baseline to return to normal is what percentage of load and volume am I at with my exercises at the gym. Now, I was anticipating that working with someone in this fashion, the measurement to return to baseline was going to be set by them, and it was going to be totally separate than anything that I had measured, maybe how far I can extend my arm or how long I can hold it above my head or something like that. But Ryan personalized it to something that was going to fit my goals. And on a similar note to that, most of the exercises that Ryan assigned to me were exercises that were going to be complementary to what I would be doing at the gym anyway, exercises that were going to build and work those same muscle groups. For example, I couldn't start off by doing bench press right away, certainly not at full load. I just didn't have the flexibility and the pain was too great in my shoulder, but I still wanted a way to work the chest muscles. And Ryan's routine would actually supplement the exercise that I'd be doing at the gym anyway. It wasn't totally separate. I didn't have to set new goals based on our relationship. It was something that I wanted to do anyway. And so in a way, it was really working out as the most effective way possible, not only for rehabilitation for the shoulder, but to continue my strength training goals in general. So Ryan really seems to me to have a one body health philosophy, sort of that every aspect of your body is connected, and mind. And I have this philosophy too, but there's exercises that he showed me that I didn't even realize could contribute to the rehabilitation of my injury. They seem totally unrelated, such as using the foam roller for rib mobilization. And when I mentioned this to him, I said I thought it was a placebo effect because I couldn't see how one possibly connected to the other. And he informed me that they are in fact connected, and the best way to ensure that the shoulder gets rehabbed is to work the whole body as a unit together. And we were making progress too. I immediately started going for hikes and things that required minimal shoulder movement, but even after a couple weeks, I was able to get back on the slopes and start snowboarding again. I had to make sure that I didn't fall, of course, but it felt great to be able to get back doing what I love and make sure the whole season wasn't wasted, because that was a big fear I had in the beginning. Ryan and I would meet every 2 to 3 weeks and work on some exercises, have some conversations about how things were going, and measure progress. And in between, Ryan would schedule new exercises for me to complete several times a week. On weekends, I would be out doing my own thing because now I had the confidence to start doing that again. So here we are 5 or 6 months later, and thanks to Ryan's help, virtually all my upper body exercises at the gym have returned to full volume and full weight. In addition to that, I can do everything that I want to do outside again, whether that be paragliding, mountain biking, gotten back into rock climbing as well, vertical rock climbing, mountaineering, and I've also started some new activities such as caving, which requires you to vertically ascend a rope. So it's tough on the upper body as well. And these are things that I wouldn't have been able to do if we hadn't rehabbed the shoulder properly, and Ryan played a huge part in that. And so just having this knowledge of the patient, having that relationship, and setting those realistic expectations in a way that's actually gonna work. If there's an exercise that I'm not doing because I don't find it effective or because it's not convenient for me or I can't get to it at the gym, we switch it, we do a different exercise. And that's the way setting realistic expectations versus ideal expectations has helped make this entire journey possible. This is in addition to having access to all the videos and resources that Ryan sent me, knowing how to do the exercises since we were meeting in a virtual manner. That was one thing I was concerned about. It's called physical therapy. How can you do it in a way that's effective if you're not meeting there one-on-one? And lastly, the reason I started meeting with Ryan was because of my shoulder injury, but the reason I'm going to keep meeting with him is because of my health and fitness goals overall. Health is everything, and I'm so thankful to Ryan for helping me get there.